This session will cover the kidney transplant waiting list at the Washington University and Barnes-Jewish Transplant Center in St. Louis, Missouri. We will be reviewing expectations of the patient, the transplant center, and the dialysis unit. We will also discuss annual testing and what happens when a patient receives the call that an organ is available for them. We will provide some case study examples as well. Being added to the wait list is an important step leading to transplant. When a patient is added to the waiting list, they are sent a letter letting them know, and the dialysis unit receives a copy of this letter for their records. While on the waiting list, patients need to be continually engaged in their transplant journey.
While on the waiting list, we ask patients to have monthly cytoscreen labs sent to our hospital lab, undergo testing every year to make sure they are healthy enough when they receive the call that an organ is available, keep us informed of any changes to their health or insurance status. Our center communicates with the dialysis center so that providers are aware of their patient status on the waiting list. We value open communication with the dialysis centers who care for our waitlisted patients and encourage dialysis staff to reach out to us if there are questions or if additional information is needed from us. Once placed on the list, a waitlist candidate continues to accrue time that starts from their first date of chronic dialysis. A patient who is temporarily too sick for transplant is placed on hold on the waiting list until their health recovers. An example would be an infection for which they are receiving antibiotic therapy. We ask to be notified when patients have health changes so that our center can make sure that when we accept organ offers, the patient is ready to come into the hospital to be transplanted safely.
Wait times can be between 2 to 5 years or longer, and patients may run into challenges that impact their qualifications for transplant. There are circumstances that a patient may be removed from the list prior to receiving their transplant. Some examples when this may occur are their health deteriorated and the patient is not healthy enough to undergo a kidney transplant. The patient decides they are no longer interested in transplant and wants to be removed from the waiting list. The patient does not update their annual testing after several requests. Or their insurance policy changes to a provider that prefers a different transplant center. Patients receive calls any time of the day or night when the surgeon receives notice that a kidney becomes available.
When a patient is called by their coordinator to come to the hospital for a potential transplant, information about their current state of health is obtained. As our team gets to know the patients well through evaluation and during the period of time they are on the waiting list, it is an exciting time for all of us as we celebrate our patients' successes. A patient can be called in as the primary or as the backup candidate. In either case, we ask the recipient to come to the hospital immediately to prepare for possible transplant surgery. In many cases, the backup candidate becomes the primary candidate because something did not work out with the first primary candidate.
Being called in is the first of several steps to surgery. Patients may receive their kidney transplant, or they may be sent home because this opportunity did not work out. Some reasons why patients may be sent home include there was an anatomical or biopsy finding on the donor kidney that makes it unsuitable for a successful transplant or unsafe. There were changes in the health of the recipient that impacted their ability to safely undergo a transplant. There was a reaction by the recipient when the donor and the recipient blood were tested that would lead to an unsuccessful transplant. There have been changes to the recipient insurance that were not known, and a transplant authorization is not in place to proceed to transplant.
Our average length of stay following a kidney transplant is 3 days. Patients will be sent home with the information they need to safely care for their new transplant and with a month's supply of all of their medications. If questions arise after discharge, there is always someone they can ask. A transplant coordinator is on call 24/7 to assist.
Let's review some case examples to illustrate what we have talked about up to this point. Case 1. Jenny is a patient who was listed for transplant in January of 2020. She started dialysis in 2015. So when she was added to the list, she already had 5 years of waiting time. She was called in for her transplant in March of 2020 and received her gift of life that day.
Case 2. Bob was listed for transplant in June of 2019. He has a history of diabetes and struggles to keep his blood sugars under control. When he updated his testing in November 2019, his stress test revealed some heart disease. He was referred to a cardiologist who recommended bypass surgery. Bob was placed on hold on the waiting list to give him time to recover. Once Bob completed cardiac rehabilitation, he received clearance from the cardiologist and the transplant team to be active again on the list. Bob is currently waiting for his call for a kidney transplant.
Case 3. Jill has been on the waiting list since 2017. She was not on dialysis at the time of listing, but has since started on in-center hemodialysis. In 2019, Jill did not complete her annual testing. She did not show up when her testing was scheduled on 2 different occasions. Jill has been on hold since her testing expired in March of 2019. Since she has not updated her testing, the transplant team makes the decision to remove her from the waiting list. If Jill decides that she wants a kidney transplant, she can be re-referred and evaluated as a transplant candidate in the future.
There are a myriad of potential pathways a patient may follow while waiting for their kidney transplant. If you have questions about specific issues, please let us know. Our team is always here to help and make this journey easier for our patients. We hope that you have enjoyed this presentation about waitlisting and being called in for kidney transplant at the Washington University and Barnes-Jewish Transplant Center. There are 3 other presentations available: the kidney transplant evaluation process, the role of multidisciplinary team members, and living kidney donation. We hope to see you again soon.